Why are there these abnormalities in the nerve branching? And then it makes you think of how birth defects are more and more common. Like a super common birth defect that we see in MySpace is a tongue tie.
Mm-hmm.
And people say, well, why are there more tongue ties now than ever? And it just sort of keeps coming back to this issue of, well, people just seem to be less healthy, or for whatever reason there seems to be more toxicity in the environment. Maybe people are having children at an older age, and babies are just seem to not be coming out quite right. There's lots of issues with newborns, whether it be Asperger's and autism, or mental health things, physical health things, and maybe this weird nerve branch thing, which, by the way, I had, if you remember. I had some funky lesser occipital nerve branches.
Yeah.
So it gets wrapped up in that. And then to add additional layers, so why did Ronnie have headaches when his head posture was bad but not terrible?
Right.
And then it's like, well, in high school, I did a lot of drinking. I drank alcohol 2 or 3 times a weekend, and I heard Andrew Huberman say on the Huberman Lab podcast that alcohol has terrible effects on the nerves, and so does cannabis. And I did a lot of that too. So maybe my nerves are especially sensitive because during a pivotal time in my youth, I was abusing the crap out of them with substances.
Yeah.
And then another layer is like, I was a library rat in college, so I was leaned over a laptop minimum 6 to 7 hours a day with my right hand on the trackpad, just scrolling and typing with that right arm dangling there. And that's where most of my pain was, on that right side. And to this day, if I use my left hand, like right now my trackpad is on the left, not the right, I try not to use my right arm. And now I'm starting to think maybe the worst of my headaches was an overuse injury to some degree, because I abused my nerves more than the average student. I did better than the average student, but studying and being an academic is to some degree a physical job. I mean, you have to keep up with the body to get through med school, for example, right? Yeah. Like it's tough physical and mental challenge.
Absolutely.
So there's all of these different factors at play. It really is multi-layered, but for one reason or another, a lot of us seem to end up with these compressed nerves, and then when we release them, the pain lets up to a significant degree. I did want to ask you about, what do you think of this idea that headaches and migraines can be, to some degree, overuse injuries of a certain side of the body? I mean, the etymology of the word migraine, I think, goes back to being one-sided, right? Doesn't it mean like hemicron, like one side? I'm not 100% on that, but I believe that's the etymology of the word. And then humans tend to be one-sided, either righty or lefty. I definitely have overused the right side of my body throughout my life, mostly on a trackpad on a laptop, going through many, many years of school, or whether it be a pen or a trackpad or a mouse. What do you? And then importantly, when I stop using that right side, that the headaches on the right side really calm down significantly, to the point where in the past 3 months, since I've gone lefty for major activities like trackpad use, being probably the biggest one, the headaches have cut down significantly from 3 triptans a month down to now, like I said, less than 1 triptan a month. Could you comment on migraines and headaches being a sort of overuse injury of a certain side of the body?
Yeah, I think that, again, is a very plausible explanation. One of the top causes of carpal tunnel syndrome is an overuse injury. You're constantly going back and forth with your wrist, and at some point, the nerve will get banged around enough against the adjacent tendons and other soft tissues, and of course the bony and fibroosseous tunnels, that you can become symptomatic. So certainly if you are significantly weighted one side to the other in terms of your use, and of course what happens with, let's say, constant use of your right hand for everything, from sports to school to other activities like playing the piano or cutting your food, your muscle development is bigger on one side than the other, which again will cause certain biomechanical compensatory problems that occur. And so I think that again, it's certainly very plausible that you have issues on one side versus another, and in some cases, ultimately the issues on one side cause an issue on the other side because it may be that the fact that your muscles are overdeveloped because you're a righty and constantly use your right hand for everything under the sun, that causes one issue on the one side, but the biomechanical compensatory mechanisms that you have to try and balance that out also ultimately affect secondarily the nerves on the left side. So again, I think these ideas, they're not at all unusual, they're not at all crazy, and I think that it makes a lot of sense to try and study them in some kind of formal way, because I would bet, especially with some of the newer imaging technologies that are starting to filter down into more common use, for example, high resolution ultrasound, which you can have even in your office. You can see some pretty good pictures if you know what you're doing. I think they're pretty. That you could easily envision a study where a clinician will take 10, 20 patients and measure the average size of, pick a nerve, the median nerve, in patients who are asymptomatic, have no symptoms of any kind with regard to carpal tunnel syndrome, and then you do the same thing with patients who have carpal tunnel syndrome, and see if you can find differences in nerve diameter, see if you can find differences in the morphology of the nerve. Is there like an hourglass shaped compression that you can see where, here's the pressure point, where this nerve narrows, there's something that's pressing on the nerve, and so if you release that, you can then image those people post-operatively, and if that's gone and that correlates with their symptoms being gone, then you have a really good way of diagnosing patients ahead of time, and you don't need an EMG, for example. If you have clinical symptoms of carpal tunnel syndrome and you see this compression, and you know that in the patients that you've studied, that compression disappears after surgery and their symptoms disappear, then those patients probably have carpal tunnel syndrome and need surgery. So, very reasonable.
Anecdotally, could you comment on some of the cases you've seen where there's been no accident to speak of, and they're just a kind of a random case like me who has these mysterious headaches at the back of their neck? Have you seen in that population, have you noticed their facial structure at all and recognized that they tend to have a bad neck posture? Have you observed anything like that?
Yeah, a lot of them will have that. They, will have some imaging studies that even as young people like yourself will have a straightening of the cervical lordosis that you should typically see. It's not anything that the radiologist would look at and go, oh, here is the reason for your chronic headaches, but it's certainly something that people have commented on. And then again, for me, more often than not, the people who seemingly have these spontaneous headaches, they're probably using their neck just like any normal human being would use their neck. But then when you get in and do surgery, they have this unusual branching pattern, which, kind of these nerves give off these little nerve twigs. And these are sub-millimeter diameter structures, so very easily torn. I mean, you could imagine just sneezing hard one day and wrenching your neck like that. That's easily enough to rip one of these branches, and all of a sudden you have horrendous pain, and no one can figure out why. So I think you put this combination of a certain type of use, a certain type of pre-existing nerve structure, and perhaps an innocuous sneeze that was a little harder than normal because you had COVID or the flu or had bad allergies one year, and boom, that's a perfect soup and storm for chronic pain if you don't recognize what could be going on.